Albumin is a transport protein synthesized by the liver. Normal ranges are 3.5 to 6 grams per deciliter. What transport protein means essentially is that it helps to move smaller molecules through the blood. It also plays a very essential role in fluid balance. Okay, so it helps move smaller molecules through the blood, including things like bilirubin, calcium, progesterone, and different medications. And then it plays a very key role in regulating fluid within the blood and it keeps fluids from leaking into the tissues. And this is what we refer to as colloid oncotic pressure or osmotic pressure. Albumin is a very large protein synthesized by the liver, helps carry things through the blood, and then it plays a key role in keeping fluids within the blood, right? Because we know that osmotic pressure essentially does, fluids will move from an area of lower concentration of solute to an area of higher concentration of solute. So albumin is one of these solutes that's within the blood that helps to keep fluids in there, okay? So it plays a very key role in that, in keeping fluids within the blood and then transporting different things throughout the blood. It's run very often. It's part of the CMP or Comprehensive Metabolic Panel. If a patient's in the hospital, this will be a test that they receive possibly daily or even more. So we assess it very often. What it helps us to do is it helps us to evaluate liver function, nutritional status, and the patient's overall health status. We can also evaluate kidney function with this. So a physician will generally run this test maybe daily, like I said, every couple days or multiple times a day as part of a CMP, or they can decide to run it when there are signs and symptoms of liver disorder, such as jaundice, fatigue, weight loss, and if we see symptoms of like nephrotic syndrome, and this would be issues like swelling, excessive edema, especially around the eyes, belly, and legs. Now, albumin can also be used along with pre-albumin to help evaluate nutritional status in a patient. So because albumin concentrations respond to many, many conditions, as well as malnutrition, it's important to really evaluate decreased levels of albumin. Some things that would cause low albumin would be things like liver disease. Typically in patients who have cirrhosis, albumin is typically lower. And so if we have liver disease, liver dysfunction, the liver won't be producing this protein, and then we might see lower levels. It can also be seen in symptoms or in situations like inflammation, shock, like we said, malnutrition, and it can reflect diseases within the kidneys. So we can run serum albumin, we can also run urine albumin. What can happen in cases where the kidneys can't stop albumin from leaking from the blood into the urine and being lost, the kidneys aren't able to retain this albumin due to malfunction within the kidneys, then we could run a urine albumin, and we might see higher levels of albumin within the urine that it's getting out. Sometimes that we might see higher albumin would be issues like dehydration. So albumin, what can really help you to understand albumin is as you start to understand really that it's produced by the liver, it's an essential protein in transportation and fluid balance. And as you start to really dive into osmosis, osmotic pressure, and how albumin plays a role in fluid balance within the body, you really start to understand how we can use this to evaluate overall health status of a patient. And just understanding how it's produced and where it comes from can really help you understand how it can help us evaluate liver function. So again, this is albumin. Normal range is 3.5 to 6, and it's very essential to liver function, kidney function, nutritional status, inflammation, and fluid balance.
This has been another episode of the Lab Values podcast by nursing.com. We have a special giveaway for you guys, a free copy of our 63 must-know labs for nurses. To get your free copy, just go to nursing.com/labs. That is nursing.com/LABS. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.